All right, 1 minute to count time. We're going to start in about a minute. If in the meantime, if you want to put where you hail from for the sake of minutes, that would be great. And we will get started ever so shortly. All right, I think we're ready to go. I am not going to publicly comment on the expected duration of this appointment. This team meeting, because every time I do that, I say I get challenged. It is a trim little agenda today, as we are just kicking off our Coding for Food work and are kind of in a refinement step within our program enhancements work, with nothing incredibly new to report there. But I'm going to kick off very imminently. Next slide, please. Welcome to the March 13th Gravity Terminology Enhancement Cycle meeting. Thanks for coming. We mute folks upon entry, but we always have conversation throughout, especially if we're a small crew. All calls are recorded, and recordings are always available on the Gravity Confluence. Everyone's encouraged to actively participate using the Zoom chat and sending comments to everybody. And anyone who's sending anything to just me, I always say this: I am liable to reading out loud. So if you have something you're trying to say just to me, it probably is a good idea to save it until after the meeting, because I tend to just read everything in the chat out loud, trying to facilitate conversation. Next slide. We are a data standards development initiative, and therefore are required to follow antitrust practices and comply. So we just apply these liberally. We announce them at the beginning of every single meeting, and really just want to make sure that we not only avoid direct antitrust violations, but anything that might be construed as it. And I see our dear friend, not new to us, but not new to the terminology ecosystem, Susan Matney, just introducing herself. Yeah, we're very, very grateful to have Susan on board as part of the Gravity Terminology team, a titan in the in the terminology world. So welcome. It's so exciting. And fully, yeah, the nurse terminologist informaticists bench.
Yeah.
It's strong. Next slide. So we are going to be going through just the classic Coding for Food updates, and then updates across the program enhancement work. Again, trim little agenda today. Next slide. Next slide. Announcements. Again, we try to keep people oriented to where they are. So, hi, Nicole. So there are weekly meetings within Gravity Terminology. This cycle, we are working on enhancing terminology for previously identified domains, basically deepening our standards-based solutions across, so just making sure that we're thinking about needed enhancements based on implementer feedback. And then, because there's still new domains to address, the other cycle, which was last week and then next week, focuses on developing new domain data standards and value sets to support them. We have, of course, the technical work stream. We really are trying to seed in here the topics that are being addressed there. So next Wednesday, 1 to 2 Eastern Standard Time, the topic will be the referral for further assessment use case, and going deeper into that. And again, we'll try to plant the next agenda item each time in the terminology meetings, just so people can orient themselves. And then implementation work streams now quarterly, so we're not meeting again until the 29th. The focus now, having achieved really significant implementation and resources to support implementation across our core use cases. In 2025, we're leaning it into use cases and examples of implementing Gravity data standards to address return on investment, like outcomes, reduce cost, reduce burden. So those are our topics, and again, quarterly. Next slide. Hi, Susan. Any questions on the announcements? Next slide. So Gravity's, what we do is we strive to create a world where health and social care organizations readily share the information needed to effectively meet the social needs of individuals, advance health equity, and improve health outcomes. By using standardized, we're working on this terminology and technology, and we have a continually trying to revise our vision, goals, objectives, mission to make sure that they better meet the ecosystem's needs. Next slide. Members, we couldn't do without you all. We always honor them. They ground our work on a daily basis. And again, very grateful for our designated members who help support with their knowledge within our social justice framework. So patients and community-based organizations supporting what we do. Next slide. The 2025 roadmap, again, we are in the light green meeting series. So within terminology, which is the top half of the roadmap, new domains are dark green. Again, we're kind of like third of the way through our new domain terminology development for protective factors, racism, and toxic stress. In the fall, we'll be leaning into new domains, and then we're working on coding for food and program enhancements and general enhancements in this cycle. Again, you can feel free to join the technical meeting on Wednesday, where they're working always on looking forward and evolving the SDOH CCIG. And then implementation, as I mentioned, is coming up in May. Next slide. And our data justice principles, we just try to make sure we say them every single time: improving personal health outcomes, improving population health equity, ensuring personal control, designing appropriate solutions, ensuring accountability, and critically preventing, reducing, and remediating harm. The very thorough white paper brief on the origin of the data use principles and the deeper definitions of them are available on the Confluence. Next slide. And then what are we doing here? This is kind of like what we do in terminology. We're gathering together to create language to address core use cases, and especially when it comes to the work we're doing in the enhancement cycle, it kind of like expands and deepens our original 4 use cases on standardized assessment, diagnoses, goal setting, and interventions, because we were really trying to figure out how to document things that look like outcomes, and really trying to lean into supporting the HCPCS terminology for reimbursement to support community-based organizations. So leaning heavily in this cycle onto the left side of the model, again, to further and deepen our solutions for social care delivery and analysis. Next slide. We are, again, so a third was right. We're a third of the way through. So we're continuing our conceptual development, and we're meeting with our subject matter experts and pretty much on target. And we're going to be addressing with Coding for Food, talking about some of the highlights and questions we're addressing in the subject matter expert groups. Just like last time, we addressed some of the highlights and questions that are coming up in our classification work. Next slide. Any questions on the general scene, and then we'll start getting into Coding for Food? I think we're good. Okay. Next slide. I don't see, so Katie, are any of our Coding for Food SMEs on the call? Can you tell?
I think a couple. I know at least Erin Franey is here, and there might be some others I haven't caught yet.
Okay, just want to make sure. I'm just gonna, I won't call you in. Hi, hi, Erin. But if you, as we head into this work, if you have anything to say, knowing that you are the experts, feel free. I'm just trying to, I will offer highlights, eating lunch, you Pacific Coaster, you. Nicole, you're also a Pacific Coaster. We have a strong California representative, in the food as medicine work, which is not surprising, in the classification work, of course. Next slide. So again, this is like what we're doing. We submitted HCPC request to CMS in December/January for our phase 1 work. Our phase 2 work is focusing on cooking and kitchen supplies, cooking education/teaching kitchen/food pharmacies. More on that in a second, why that // is there. I just want to note that just as with phase 1, and you'll see this very shortly, part of the work of working with subject matter experts also means that sometimes what we thought was one concept splits into two. We saw this with groceries last time, and we're seeing this as well because our work as terminologists, the definers, is to see what whether in all the implementations of the thing around the country, if there's a common theme and a common definition, or if those definitions actually might require 2 things or 3 things or 1 thing with a modifier. So this is what we work on as we work with our subject matter experts, just like deep listening and questioning and making sure that we're arriving at something that is clear. We're very, really grateful. It's just fun work to do with our food SMEs, and everyone who knows me knows it's going home because food is my anchor. All the work on Coding for Food is found in the Confluence, and it is an ongoing build off of the work we started in 2019. More on that in a second. Next slide. The work structure, I say this every single time again. Thank you, Katie, Etman, Meg Davidson. Katie and I have been working on this for 5 years, 3 years, many years, so many years. 3, yeah. It first came up in 2019, and then officially working on the Coding for Food initiative for 3 years. A long time, and here we are. The great thing about that we have good partners in this work, our friends from the Partnership to Align Social Care. We do try to collaborate on initiatives that are, so this is probably within Gravity's set, like terminology development. And then we work with Partnership on things like intervention, which is their wheelhouse, right? So we do a really good job collaborating with our buddies. Because of the importance of the work, the subject matter experts are within an advisory. We'll talk more about that in a second. And so there's an all national advisory. There's subject matter experts within it. It's also within Gravity. And so there's many, many layers of consensus and review so that when we hit send on the HCPC submission, it's truly a national consensus statement, which is pretty exciting. So we're meeting with our SMEs every other week on the path toward that 5/9/27/5/29 consensus vote. And then I will work with my friend Tim to submit it to CMS for a request in June. And I just want to note that, I'm sure many people are aware of CMS rescinding the table for HRSN covered services. And there's been a lot of talk about this. We do know that the foodist medicine area that these interventions exist within is it's like the most developed of all of the concepts within that table. It also is the one that has the areas within foodist medicine are the ones that have the most robust, like a significant amount of robust evidence. There are some really critical housing interventions that also have good evidence, but more on that later. But just noting that we still feel pretty confident about proceeding forward, given even with the change in that guidance, and it's kind of full steam ahead just based on the state of the world right now and existing implementations that require these concepts and are hungry for them. So going forward with full steam ahead. Next slide.
Sarah, can I add one more bit there? I'll just say, in addition, so lots of the states that are implementing these right now are using those health-related social needs flexibilities, but there are a couple states, including California and Michigan and some others, who are using different federal flexibilities that are actually authorized through statute. So even if they are now looking at health-related social needs in a one-off versus a blanket commentary, there's still lots of implementations, and they have been clear that they are not rescinding any implementation. Correct. So still deeply important technology infrastructure to happen, just maybe happening in a slightly different way.
Yeah. So suffice to say, go team. Still relevant,
Keep
still
rolling.
important, onward. Yes, it's important to call it the Michigan, the in lieu of services work there is, yes. Okay, onward. Next slide. So this is the amazing Coding for Food Advisory Committee. Longtime friends and brilliant folks, and many of them Gravity members or longtime collaborators, and very, very grateful for Fullwell for gathering them all and making sure that their expertise is laid to the project. Next slide. And then these are the subject matter experts within the two different work groups. Again, the cooking and kitchen supplies group, and then the cooking education, teaching kitchens, food pharmacy work group. Very, very grateful for all of them for coming to this work. And thanks to whoever is on the call. Erin, I see you. And who else was on the call? You said there was somebody else maybe?
Meg is here, and then I think I thought I had
Hi.
seen Cecilia, but maybe she's been able to hop off.
Okay, regardless, welcome. Next slide. All right. Okay, so what I'm going to do now is just kind of give the highest highlight of our first meeting because it's important that you all kind of come along with us so that when we are shaping this work, we're doing it in transparency. The most important thing to note in our early conversations was the breadth of different types of provision across different state programs, meaning some programs are giving like just basic kitchenware, some are doing kitchenware plus some core condiments, and some are doing kitchenware plus appliances like refrigerators and large things like that. So we had our early conversation was on whether that would be able to be encompassed by one concept or whether we would have to have two concepts and stuff. This is what I was mentioning before. The likelihood is that we will actually have to have two concepts, and the reason being that refrigerators are used across health-related social needs service provision beyond just food-related services, right? So if we did it as a combined concept, kitchenware, modifier, refrigerator, those instances where refrigerators are only given for medically necessary reasons for housing, for refrigerated medications, which is a common implementation across state programs, would be difficult to be represented by that concept. Okay, that was a lot of words. I hope that makes sense, right? So refrigerators are sometimes given with cooking and kitchen supplies. Refrigerators are sometimes given not with cooking and kitchen supplies, but with totally different needs for totally different purposes, medical necessity and medication refrigeration, right? So that being said, we're likely looking at two concepts, right? Because we need to allow them to function independently. And that's where we started, right? We said, okay, this is interesting. We're likely looking at two different concepts because we want to allow them to function independently. More to come on that. And we'll come back like every other week and still revisit with you, but that's my original assessment based on the concept at this time. Any other thoughts on that from anyone? I'm sure it probably just makes very clear sense. It's kind of one of those like, of course. But yeah, so just noting that that's where we are right now with our team, and we'll do more when we come back. Next slide. So on the cooking, education, teaching kitchens, food pharmacy set, there's a lot of different variations and variables that we're discussing. I'm going to try over the next few minutes to describe them to all of you. There are differences in education content, right? Some classes teaching about nutrition concepts, some classes focusing on cooking skills, some classes combining them. There are differences in education delivery. There are one-off examples, like one class on knife skills or one class on X, right? And then there are series of programs. I mean, a series of lessons that are delivered and you sign up for a whole series. Some of the series are based on an established curricula within the principles of pedagogy, like point to, for the purposes of this program, we reference X standard and some do not. And then there are also different, I hope that part makes sense, right? Because sometimes they point to an evidentiary base of a way to deliver like cooking education or healthy kitchen education, and sometimes they're more informal. And then sometimes there's also differences in the professional providing the education, whether it's delivered by an RDN, a registered dietitian nutritionist. Happy RDN and Nutrition Tech Week, by the way. It was RDN, National RDN Day yesterday. Woo! And it's National Nutrition Tech Registered Day today. This is what you get for following everything RDN on LinkedIn. You find out all these things. So just 3 cheers to our RDN friends and our nutrition professional friends. Sorry, heroes in the world. And then sometimes the MDs, NPs, PAs, or RNs do it. Yay! And then I forgot to put it here, but there's even variations in who's receiving the education. Like in the grand scope of teaching kitchens, sometimes students, like med students, are receiving it, or or nursing students. And so we're very clear that we're focused on patients here and people and community members. We didn't include that in this slide because that's a clear out of scope, right? There's also, of course, variations in setting. That's not as critical for the definition. Like sometimes it's done in clinics, and sometimes it's done in community-based organizations, and sometimes it's done elsewhere. The last variation that we're noting is there's differences in food provision. Sometimes taking home food is a core component of the service, and sometimes it is not. What we know now in phase 2 is the food is a core component of the service is likely or hopefully going to be able to be represented by the concepts we delivered in phase 1. And we can focus on the teaching component in this phase. At least that's what we're kind of getting to, right? Because we spent a lot of time in phase 1 talking about getting food to people who need food, right? Through produce prescriptions, medically tailored meals, medically tailored groceries, and healthy groceries. So we're hoping that the food provision focus can be addressed by one of those previous concepts, and we can really lean into what's common across these, which is the education component. Katie, did I cover it? Okay. Erin, anything to say? Else to say? I hope, sorry to call you in here, but
no, I love being called in, and that was such a great summary. I'm really glad I'm attending this because it's like further processing all the information. So it's really good. You're doing a great job, Sarah.
Fantastic. Go team. Okay, so we'll continue refining these things. Some of them, some of the variation here is we'll be able to be represented by things like a modifier. Like if we figure out and some of the variation might require an additional concept. We shall see. One of the things we use as a precedent, only because we know it is paid for, is the standards for diabetes group education, right? Because there are existing standards for diabetes education, both singular one-on-one and group education, and the role of RDs in that work and the curriculum one needs to reference, right? So there is a part of what we're looking at when we're doing this work is precedent, right? So there is that precedent of, the way that diabetes education has been standardized across all payer programs, right? And so not just Medicare and Medicaid. So anyway, those are the precedents we're looking at. Any thoughts from the assembled folk on this? No? Okay, more to come. Meeting with our SMEs next week. Synthesizing information back in 2 weeks. Aiming towards a consensus definition or 2 or 3 or 4. We got it. All right, let me just see. I hope I didn't miss anything. Yes, EARDs. I didn't miss that. I'm just gonna say it again. Okay, next slide. Okay, I don't think we had any questions. Next slide. Program enhancements. We're now shifting. So for those of you, bye Katie. For those of you who want to sign off and you were food focused and you don't want to stay for the program enhancements, that's fine. We are here to talk about our program enhancements work over the next slides. Next slide. And again, this is just a brief highlight because truth be told, the SMEs did so much work that Sarah and I have a lot of work to do. So we're knee deep in reconciling classification. Bye, Erin. are reconciling classification updates, but we just wanted to make sure these are the core topics we're addressing in the program enhancement cycle. Ensuring number one, and this is all again in response to implementer feedback, ensuring all of the programs that we've defined at Gravity are transparent and available, and with definitions, so community members can see them, see if there's programs that are missing, and analyze the definitions for alignment. And then we're also doing work on the program classification, which is the heft of what, like, it's going to be a year-long project, friends. We got this. I'm very proud of our program classification SMEs. Hi, Lena. And so that's developing an open consensus program classification of Gravity programs for the purposes of navigation and connection. And then there is the program documentation work, which is consensus on method for documenting service delivery and program enrollment. And this is what will always take up the second half of this meeting, these 3 topic areas. Next slide. Program term analysis. We are not covering, I had thought that we might cover program documentation today, but we're kind of putting a few more things in the hopper, and I have some conversations to have with my technical work team friends. Corey Smith coming soon to a meeting near you. So we're going to focus on program term analysis and a highlight and just update on program classification, and then have a little conversation and then go from there. Next slide. And again, this is just, I mentioned this, it's really important to all of our organizations, our health and human service organizations, our social care entities, to see the definitions that we have for critical human service and social care programs. They all are coming from human service and social care definitions. And so the concept, the definition, and the reference are now all available on the Confluence. And you can see, so if you go to the next slide, you can just see that we presented this last time, but on the Gravity Confluence, in the resources for implementation section is the really lovely work of the amazing Sarah Bahal and our friend Himali Saitwal, which is, and the work of all of you, which is a table detailing the program, the definition, and the reference, and whether it has includes but not limited to. And again, this is fundamentally because you cannot see the definitions and the references in the terminology or in the value sets. And so we needed to make it transparent to you all, that the definitions were there just to make sure that everyone understands where the words came from, and everyone can see that it's, for federal definitions, like from Administration of Children and Families, Administration of Community Living, et cetera, like HUD, et cetera. Again, so this is all available on the Confluence, and hopefully, if anyone has any questions or feels like something's missing or not correct over time, we can do enhancements through just emailing gravityproject@hl7.org. Next slide. Okay, classification. Quick update here, and then I think we might be able to end our meeting early. I think I was correct. Next slide. And so this is the classification pathway. I'm so glad you think so, Mike. Yay. Okay, yay. I know some people are like lexicon. But given that, and I think you know better than most people that it like Gravity develops so much terminology that I think it can be hard to feel that, the words we use are the words that are well known and used and centered in communities. And so this was our act at being accountable to that and showing that they are. Like, we don't want to disrupt the way people are talking about things and the reporting mechanisms and requirements of the programs that are being delivered in communities. And so we just pull in the definition and the reference from them. Okay, so then, so we're doing our program classification pathway. We're really just doing this iterative refinement of the classification over the course of the next few months. And again, we're going to go more into it on the next slide. Next slide. So our experts, oh my Lord, they're so kind and patient. It is, I'm going to say it is meticulous, painstaking, and sometimes grueling work to do the classification. Huge Huge thanks to our friends at 211 LA. Nicole's on the call today. Find Help. Carla comes on a regular basis. Epic sends Jacob and Matt and Owen and Trent. Thank you so much. Unita sends the Mollies, Molly. And our friend Elena Kalowski from 211 San Diego comes as a regular basis as well. Again, these subject matter experts. And then 211, it's Nicole and Keith, I should say. I don't know, Keith, if you're on the call, but again, just thank you to all of you. Again, we wouldn't be able to do this work without you. It is tiring, but important. And we're grateful. So again, the purposes of the classification is develop the classification for the purposes of navigation and connection to services by everybody, by healthcare entities, social care providers, and people who are self-navigating. And I think it was Laura Gustin who presented the self-navigation use case at the Connect-a-thon from Together Now, our friend Laura, who was part of the social care voice co-design, but we always want to make sure we're building solutions for people to navigate to services on their own, right? So that's part of what we're thinking of when we're doing the classification. We do want to note that even though we are building our classification for navigation and connection to services, they can be used for other use cases, and then eventually we'll publish it. Next slide. You've all seen this enough, so I don't think we need to go into it. So in bold is like, so when you look at the classification concepts, in bold are the concepts of the groupers, and then gravity comes up, gravity and 211 HSIS kind of marry in the next level. And then 211 takes it to a further level of granularity. And so grateful for their the specificity of how they build out the programs in their taxonomy. Next slide. I think I only have high level concepts here, so no details. We did deep in details last time. We presented on how we consider paths to enrollment last time in our organization of the classification, because it's in order to actually successfully connect to services, you have to consider enrollment needs within how people are navigating to them. So domains, phase 1 domains are food, transportation, housing, utilities, employment, material goods, social connection and engagement, physical health, mental health, substance use, and legal help. Domains addressed for phase 2 so far, financial assistance, and then we are doing direct care at this time. So this is what we do with our first draft. We just go through, and again, so every single one of the classifications is side by side in a spreadsheet, and entity, a subject matter expert, takes lead in finding the common themes across each of the classifications. And then we reconcile any differences to create this open consensus classification. And so each different domain, SME took lead on, and then we all sit twice a week for an hour and just reconcile and sort. Next slide. So we wanted to note, so this is since we last met, when we met a couple weeks ago, the SMEs had done through utilities, and now they've addressed through social connection. So again, sorry, if we go back one slide, it's gonna be a lot clearer if we look one back slide. So you can see, so we were at utilities before, so now they've addressed at new domains of employment, material goods, and social connection and engagement. So those are going to be part of the final draft that we post as part of this, the public review cycle. So now we can go to the next slide. Sorry, it's hard to see them. It's so much that Sarah and I didn't finish our homework. And so we're going to post it on Tuesday. Usually we post the final draft by end of day Friday. But Sarah and I need another session to integrate all of the edits to the final draft that SMEs decided. So there will be a new draft on the Confluence by end of day Tuesday. Any questions on that? SMEs, do you want to talk anything that happened within classification since we last met? Are we good? Okay. We might actually give everybody back time. It's amazing. It's amazing. All right, so end of day Tuesday. Thanks for your patience. Sarah Bahal and I and the whole group terminology team were busy little beavers, and so there was a lot to upgrade. Next slide. I just want to note, I mean, I mentioned this last time, but we really are looking for at least one more intentional reviewer of the final draft. And so we have right now 2-in-1 Epic Collaborative, which is led by 2-in-1 Wisconsin, which is a multi-state 2-in-1 Epic integration initiative, which is a perfect reviewer of the classification. They've signed up. The Community Action Agency Data Interoperability Work Group has signed up for intentional review. Again, another critical connector because they do navigation and connection to services in their daily beat. We also have direct agency review that we're going to be doing, specifically SAMHSA, because of the mental health and substance use elements in the mental health class, part of the classification. And if you have any other, again, intentional review means we're sending the classification to you for a period of time for you and users who are accustomed and experts in navigation and connection to services to review it formally, and then it comes back to us and we'll integrate those comments into a final draft. So if you have any ideas of anybody else you want to have be part of this work, just let us know. We would love to include them. Any other questions? That is the agenda for today, I think. I think next slide, I think we're good. Thanks everybody for coming. Again, brief meeting, sorry, highlights, mostly because Sarah B and I have to do work in the reconciliation. Next slide. So review information on coding for food. If you want to review the lexicon of human services and socialize that, please let us know. The draft classification will be, the final draft will be posted on the Confluence on Tuesday, and we will see you back here in a couple weeks. And there is a new enhancements topic that'll be coming in a couple weeks, which is our kind of socializing some work we have to do to develop new social care document types and develop link codes for them to be aligned with US Core in our update for the implementation guide. That will be fun, talking about social care document ontologies coming soon. Any other questions before we adjourn? Thank you for this brief little meeting. It's nice to have time with you all. Thank you. Any other questions before we call it?
Thanks.
5, 4. All right. 5 friends. I hope you have a lovely evening. We will see you at our other calls and see you back next week. In my anticipation, this is one of those lulls where this is one of those few meetings that we don't use up, and then it gets really thick and heavy for the rest of the time until May. Bye.